Hello, friends. Today we are going to discuss self-regulation in kids. I will cover this particular topic in two parts because there is a lot to discuss. What exactly do we mean by self-regulation? When we have some kind of overwhelming experience, like the sensations in the environment are not comfortable, or we are not comfortable in a social situation, anything that is putting a pressure on our mind, on our sensations, on our nervous system, and we are able to regulate ourselves, control our behavior without harming self or others, or even do any kind of disturbing behavior. That is what self-regulation is. This starts to develop at around 18 to 24 months of age. Before that, children really do not understand the effect of their behavior, what will be the consequence of behavior. But after about 2 years, they start to realize this cause and effect relationship. The first step in self-regulation will be then first identify where your child is losing or is not able to regulate themselves. Now, why is it important to recognize where your child loses their control? Because you will have to make goals based on that. Let's take an example. Your child has a poor emotional control. So they would cry very easily, even very, very trivial things. Like the toy was not kept this way, it was turned around. Or they were not allowed to sit in a particular position in the car. Usually they sit in front, but today they happen to told to sit in the back. At these times, if you feel that a child is showing any kind of extreme emotions, just like I mentioned, they cry easily, but also they get angry very easily. They become frustrated, irritated. They start throwing things. They start throwing tantrums. They refuse to get into the car, or they are hitting you or hitting themselves, harming themselves in some way. You really want to control that behavior. Now, this is very important to understand. If the stimming is very simple, like shaking of legs or just sitting like this, drumming their hands together, which is not exactly going to be a pain for them, or they ask for a particular toy to hold in the car while they are traveling, understand these are just ways by which they are trying to overcome their sensory overload. It is okay. Don't try to really stop these behaviors. If you are not comfortable with such such behaviors of children, like they are trying to run away from a social situation, they try to escape that because they do not like this crowd of people, in that case you can try to redirect them. First, you can keep some kind of sensory toys, simple ones that you can carry around like a small sensory kit. So that can have some kind of squishy ball, like a squeezing ball that calms them down, or some kind of textured ball that they feel more calm with. Or you can, for example, the child has this fascination for looking at bright lights continuously. If you're there for 1 hour, the child is ready to look at those bright lights continuously. You can engage them in dancing with those lights if there is music available, or you can give them headphones where they can listen to some kind of calming music, or you can provide them with a very simple toy like a kaleidoscope where they can look around and they can direct it towards, and they can try to engage other kids with them over there as well. You can check out my video for where I have explained what kind of stimming is okay for the child and where you really need to intervene and what interventions you can apply. You can use this punching toy with the child so they can continuously punch it and they will feel so much relaxed because they are able to vent it out. So whenever you feel you want to hit me, I've got a friend for you. Why don't you meet your new friend, the dolphin? You can hit it. It's okay to feel upset. Try to hit it. Let's do it together so that they understand it is okay to hit that toy. And once they are self-regulated, their anxiety goes down, they will automatically stop. Something to chew that calms down the child, preferably not sweets, as I always mention. Then some kind of fidget toys like a puppet. So children are okay, they're playing it everywhere these days, so it is okay to carry one around. If the child shows this kind of overwhelming behavior, so for example, you're making them do homework or some kind of activity where you're making them learn, try to alternate one activity which they like, start with that. Take it for at least 5 minutes, then alternate with the activity that you want to do. So first day, do not push the activity on them, but just introduce them to the activity, show them how you're playing with it, see how interested they are. Next day, you can manually guide them to play that activity, or just say, can you finish the last step, please? A very big problem that parents tell me is, what if it is related to smell or taste? What do we do then? They are trying to repeatedly pick up objects and try to smell them, maybe like a Play-Doh. It is okay to smell such a thing. Just direct them towards the activity as well. Okay, smell and then smash, or smell and then let's knead the dough, and then let's smell again and then put it back in the container. Do you smell it? Oh, it's gone. A very good way to direct a child towards smells or making them understand good and bad smells is your facial expressions. Facial expressions are a great way by which children learn imitation. Also helps you to get their eye contact. So if you have a good smell, you say, that smells so good. But if it's a bad smell, like the child has gone to the toilet, or there is a dump truck outside, or near the dust bin, at that time you can tell them. Near the trash, you can tell them, oh, it's a very bad smell, let's get away from there. So from your expressions, even if they look momentarily at you, they will get an idea that this is not a place where you should be standing for too long. If your child tends to escape from a social setting, the best way is always prepare the child for what is going to happen. So for example, we are going to travel by car for some time. We'll reach that place, there will be a good number of people over there. Mama and daddy might be busy over there talking to some people, but I have these toys for you. You can ask me for those toys, but let's try to first say hello to everybody if you're comfortable with that. So just build up. It's okay if you feel that my child does not even listen to that, my child does not understand what I'm saying. It's still okay to prepare the child. Or you can prepare one step ahead, like, okay, we are going somewhere, we are going in the car. Where do you want to sit? So already you are laying out that thing that they can comfortably sit wherever they want. When they reach over there, would you like to say hello to everyone? If you see that the child is not interested, don't force them initially. Let them get comfortable with the environment. Maybe the sounds are not comfortable. If you feel that yes, the child is getting their meltdown, immediately hand them over their sensory toy, fidget toy, chewy thing, whatever you have brought for them in your kit. Let them relax in that environment. After that, you can try it again. Check out my next video also, where I will cover the rest of the details of how to make your child practice self-regulation. So follow me regularly on the channel of Road to Rehab to get much more information regarding therapeutic techniques, both for children and for adults. Mention in the comments if you have any other video suggestions for me. Please like and subscribe to the channel as it helps my channel grow, and we'll meet again soon. Bye.